Michael, is my video working right now?
Yes, it is.
Okay, great.
Yep. Well, welcome everyone to Real Balance Global Wellness Services webinars. These webinars are archived at realbalance.com in the wellness resource section. And just want to welcome you to Real Balance. We are one of the world's leaders in health and wellness coach training. We've trained over 10,000 health and wellness coaches all around the world, and we're fully approved by the National Board for Health and Wellness Coaching and by the International Coach Federation for approved coach-specific training hours. So really want to welcome everybody here. And really, the way this works, you are muted upon entry. And what we're going to be doing is have you really participate by using either the chat function or the Q&A function. So be ready with some questions, some comments, because we've got a really special guest and a real important topic as we head into the new year. And, you know, even though we actually started the new decade a year ago, it almost to me feels like now is when we're finally starting the new decade. Like we just kind of had to hold our breath through 2020, and now we can actually get it started. So we do have with us Leigh-Ann Webster, the director of the National Board for Health and Wellness Coaching. Welcome, Leigh-Ann.
Thanks, Michael. Thanks for having me. I also agree with you. It does feel like we had to put 2020 on hold and now we can move forward.
Yeah, it was, I think everybody has been talking about the time warp, you know, the whole year was. So what we're going to be taking a look at is, in fact, 2021 trends, but also kind of a bit of a bigger picture. Where do we kind of see the field heading in the next, 9 to 10 years as well? What are some of the bigger trends that are going to affect health and wellness coaching, wellness in general, health promotion, all of that? It all kind of works together. And one of the big things, of course, that we have seen are a lot of adaptations to this whole pandemic experience. And one of the things that I've been hearing a lot about from the students that I teach, and they've been telling me a lot about all the clients that they're working with, is a lot more awareness around the importance of being healthy and new awareness of maybe ways to be healthy because of COVID, because of the lockdown. Have you seen that also, Leigh-Ann?
I definitely have. Yeah, I've noticed an increase in our volume of phone calls, not just from people who want to become health and wellness coaches, which that volume is up too, but also from the public who is searching for a health and wellness coach and wants to access one through our directory. So I've definitely noticed an uptick in that. And when I talk to people, a lot of times they say they want to be healthier just in case they should become sick. So yeah, I'm definitely seeing that.
Yeah, absolutely. Yeah, what I've been hearing a lot about is a lot of surprising appreciation. It's kind of like this whole thing has been a double-edged sword. One sword cutting horribly, killing so many hundreds of thousands of people and all the tremendous loss and economic loss. But the other side of it for a lot of people has been, okay, I'm not doing an hour commute each way. I'm actually noticing more in my environment. I'm having to be around my family more, and I'm actually getting to know them. And hopefully, in most cases, I kind of like them,
Yeah, I mean, I think there's that. And then the other thing that I've noticed people saying is that they're cooking more.
Yeah.
And so as a result of that, they're becoming more conscious about what they're eating and definitely wanting to spend more time putting good food in their body. Whereas before they might have just been, running out to get takeout or a restaurant. And at least in the state of California, we don't have that option right now.
Mm-hmm. Yeah, people have just gone into all kinds of things. I know we've all seen the shelves bare of whole wheat flour.
Yeah.
People learning how to make bread and all kinds of things. It's been pretty amazing. But another adaptation has been how people have been working at home. Everybody has been buying a new laptop and, an extra computer and getting online and jumping on Zoom and all these virtual meetings. So in the world of health and wellness coach education, one of the things I think you saw, Leigh-Ann, was this second item here, where we're talking
Definitely.
about, yeah, more specialized education.
Yep. Yes. What I'm starting to see is that a lot of the approved training programs are starting to take a deeper dive either into, group health coaching or lifestyle medicine. We're also receiving a lot of phone calls from people who want to work with somebody who works with pre-diabetic coaches or diabetic coaches. So there's
Mhm.
just overall just more awareness around all the different aspects of health.
Mm. Mhm. So as the demand gets more specific, the education gets more specific. Yeah,
Definitely. Yeah. And I think there's also more access to the education
right.
because everything is virtual right now, right? So, and it's not just that things are virtual right now, it's that people have learned how to use the virtual space.
Yeah. So they're more comfortable with it, more likely to
Mhm.
sign up for those classes and actually take them.
Right.
Yeah.
Exactly.
Yeah. We've really seen that at Real Balance as well. Yeah.
Yep.
Very
Now,
much.
oh,
Go
the
ahead.
flip side of that is that one of the things that's happening is that people are spending too much time on Zoom,
Yeah.
right?
Yeah.
Or whatever their platform is, and realizing that, and wanting to work with health and wellness coach for that reason.
Hmm. Exactly. Yeah. Yeah. The downside is there's a greater connection virtually, but less connection personally.
Mhm.
And unfortunately, what we've been calling social distancing, we really need to rename physical distancing because the social connection we have to have.
Right.
It's so connected to all our health risks when we're socially isolated. It's just amazing.
Yeah.
I think another thing we're hearing a lot about is that coaches are brainstorming with clients more about how can I kind of create my own home environment to do what I used to do when I went to the gym or I went to the company's fitness center or something like that. Having to come up with ideas for, well, how do I do this on my own?
Right. Yeah. So actually more ownership, right? So more
Mm.
ownership of their self-care.
Yeah.
Forced ownership of self-care. And then also the other thing that I see, because I don't just have this role with the national board, I'm also a certified personal trainer.
Hmm.
A lot of people have been calling saying, okay, I can't, there's no access to weights, right? Buying weights at Dick's
Oh, right.
Sporting Goods or online, it can't exist. So people want to know, what can I do with my own body, right? How can I work with my own body weight?
Yeah.
So that's another interesting thing that's come out of the pandemic. But again, that's uh, 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 taking forced to take care of yourself and be creative about how you're going to do that.
Yeah, exactly. Yeah, I've been mentoring a woman in England who's a wonderful fitness trainer, and she's had to go completely virtual in her clientele,
Hmm.
and she's figured out a way to do it, which is not easy. You know.
Yeah.
Yeah. So one of the things that I wanted to share with everybody was a new report from the Wellable folks about employee wellness industry trends. And looking ahead in the new year from this big survey they did, and they surveyed hundreds of employers, they found that there's going to be less investment in some of the tried and true solid things that wellness programs have been doing for years, like health fairs, like health risk assessments, biometric screenings, as well as you can see there, providing some healthy food at work or on-site fitness classes or gym memberships. There's going to be less investment in that. So what do you think that means for health and wellness coaches?
Well, I mean, if there's less investment in that, again, it comes down to the onus is more on the patient or the client, right? To take care of themselves and figure out creative ways to do that. That's what
Yeah,
I would say. Just
I think
figuring,
that, go
yeah.
ahead. Oh,
Oh,
that's
just figuring out how you can bring health and fitness and balance into your own life on a
right.
regular basis. And I think health and wellness coaches will have a very instrumental part in that because they will work with the client to figure out what their intrinsic motivation is and what's really going to drive them to do that. So maybe the conveniences that have always been there for them will no longer be there. So
Right. Yeah, that's true. We're going to have to be more self-sufficient. Blessing in disguise here may be that in the long run, people are going to be able to maintain their wellness lifestyle a little more self-sufficiently. I think another industry trend here, well, one of the trends here that's going to have an implication for coaches is the cut down on biometric screenings and health risk assessments. A lot of coaches get referrals because of that. They work in wellness programs where when somebody is, off the charts with their health risk assessment or their biometric screening says, boy, you're really at high risk, they are often referred to the health coach, wellness coach, for help. And I think we're going to see less of that and maybe less of a reliance on the whole health risk approach, which has been kind of dying anyway in the wellness field. Even Dee Eddington has kind of abandoned health risk assessments, which is pretty astonishing.
Yeah, well, I mean, I think some of that probably has to do with technology, right? So the self-quantified movement, which would be, your wearables, right? And the data that you can get from your own wearables. So you can, figure out, like, you can even do an EKG now on your iWatch, right? So those, again, it comes down to that autonomy and sufficiency. And I think that's interesting. I mean, I hadn't really thought about that with the biometric screenings, but it does make sense because people have access to their own data now in a different way.
Yeah, more and more anyway. So here's what employers think and believe they're going to be investing more in. They see more need for this. And this is kind of the direction they're going to put maybe some more money in. And what does that mean for health and wellness coaches?
Well, I mean, if you look at it, I mean, mental health, so investing more in mental health and, health and wellness coaches would fall under that. That would mean more business for health and wellness coaches, right? Telemedicine, I think that's great because what that allows for, and we're just for full transparency, we're still trying to get full clarity on telemedicine, the regulations in working with a physician and a health and wellness coach. But what we do see is that there is a lot more telemedicine happening, and the physicians can refer more easily to a health and wellness coach who can then practice virtually, right? So that opens the doors throughout the country to work with people.
Yeah, I think so.
Yeah.
I think one thing about the mental health, I think what we're going to have to be very careful about, though, is when do we refer to a health and wellness coach and when do we refer to an EAP counselor, and make that clear distinction, because health and wellness coaches are not trained in, and it's totally outside the scope of practice for them to be working with serious mental health conditions. And that's where referral to a mental health professional is really important. Although we can also work with mental health patients and help them with their health and wellness while they're seeing a therapist or getting treatment otherwise.
Yeah. And when that came out of my mouth, I thought, oh no, Michael's going to say something, but you'd actually understand it better than I do, right? As given your other training. But I think you're absolutely right. And I do think that scope of practice for health and wellness coaches is going to be even more front and center than it already is. And it's actually a topic that comes up a lot from people who are either emailing or calling us. So I am already seeing it more than I ever have before.
Yeah, I think the vast majority of coaches out there want to be very careful about that. And myself as a psychologist and as actually the person that chaired our national board code of ethics development and scope of practice development, that's something, of course, I think is really important. And people can go to the national board website, and NBHWC.org, and get that scope of practice word for word right there.
Yep.
The other thing is the other two areas, of course, are strong suits for health and wellness coaches: stress management, resilience coaching. I think more and more coaches need to get more and more training in that, and the whole mindfulness meditation thing. It's a
Mhm.
great combination for coaches.
Yeah. Well, I think too that because of the pandemic, there has been a lot more emphasis on mindfulness and meditation, and
Yep.
people have had to really dig deep to feel good during this time,
Mhm.
right? And to survive having their kids at home with them full time, schooling virtually while they're trying to work. And I'm one of those people. And sometimes having that ability to practice mindfulness or to meditate can really help.
Absolutely. Yeah. So the same report looked directly at health and wellness coaching. And this is what they said. They're going to be seeing investments staying relatively consistent, although they offer a more personalized approach. Cost often prevents more adoption. So that's how it breaks down: 23% more, which is great, 57% about same, only about 21% less. So to me that says our field is really being valued.
Mhm.
What else do you think that implies?
Well, I mean, I can tell you that it's been really interesting in the last 6 months. I have received numerous meeting invitations and phone calls from investment groups that were wanting to learn more about health and wellness coaching.
Really?
So, oh yeah, definitely. I'm definitely seeing it. I'm also seeing groups of people who are coming out of MBA programs, but also have coaching experience or an interest in coaching, wanting to learn a bit more about it.
Mhm.
So definitely, I think health and wellness coaching is a very hot topic right now, and I think that those people who have large funds are paying attention, so it'll be interesting to see what happens in the next year or two, because it does take a long time for that to develop.
Oh, sure, sure. Yeah, but I think this is kind of reassuring to people in the field, or people that are students that want to learn to be health and wellness coaches, to know that the field is on the uptick. It's not, and it's interesting because they're talking 2021. They did all this right in the middle of the pandemic, so they're seeing a continued need for it. In fact, an increasing need, I'd say.
Yeah, and I think though that it's a good thing that we have training and education standards in place now, right, for the
Oh,
industry.
yeah, really.
Because if we didn't, you could see how this could really start to develop and go in the wrong direction.
Mhm.
So, I think having just approved programs and standard and board certification is actually speaking volumes to those companies that are thinking about investing, and they're realizing that it's important.
Absolutely. I think, you know, anybody that's in the field has become aware of the importance of the national board that you direct, and the work that you all have been doing and that I used to do. I'm happy to be a board member emeritus now, and sit back and enjoy all the work that you're doing and the accomplishments that are happening. But I think it's really become clear that there's a distinction between someone who is poorly trained from a program that would never even meet your standards,
Yeah.
or maybe they're just simply a healthcare person or a consultant of some kind. And we saw this in the life coaching field, business and life coaching at the beginning, where people would just say, oh, well, I've been working with people individually for years. And I remember one of the very first trainings I did for health and wellness coaching back in the late 90s. A nurse came to me and said, I've been a coach for 25 years.
Mhm.
Oh, really? Yeah, I've been educating people individually that whole time. And yeah, you've been talking to people one-on-one, but were you really what we would call coaching?
Right.
And having these standards that have been developed by the board does so many things. It reassures people that people that have come from an approved program are kind of automatically vetted to a certain degree.
Yeah.
And then we can do research where we're comparing apples and apples, you know, that it's really coaching that we were studying here.
Right. Right. Yeah. And actually it's been really great because the evidence base is growing, right? So
Yeah.
with that training and education standard in place, you can actually grow the evidence base, and that speaks volumes, you know, to those in healthcare, to investors, to programs that are just coming on board, and to people who want to become health and wellness coaches.
Oh, absolutely. Yeah, that's been wonderful. You know, when we first started this field, you know, it was a new field. And of course, we had to build the research base.
Right.
So people were saying, there's no evidence that it works. Well, now we have volumes of evidence that it does work. So that's been really cool.
Yeah, and actually, if anyone here wants to see what is out there, just Google the Compendium of Health and Wellness Coaching Literature, and that was first created by Gary Swarzo in 2017, and then it was updated in the spring of 2019. So it's amazing. So you should totally check it out.
Yeah, definitely. It's the go-to resource, hundreds of studies, and indexed really well. Yeah, that's great. So some other trends. One of the things that you mentioned and that we've really seen here at Real Balance too is group health and wellness coaching. You know, we're talking about the affordability factor. Well, group coaching is one way to make it more affordable to more people. And it's really great when somebody has a shared health challenge with other group members. That's a great way to do health and wellness coaching.
Yeah.
And I know at the board there, you all have been, I think, actually working on trying to create some guidelines for health and wellness coach education on a group level.
We have, yep. So we have the competencies created. And then the next step is actually to involve people like you, Michael, who have been doing this for a really long time. So we'll be reaching out to the approved programs and creating a task force to, you know, figure out the next steps, such as a validation study, integrating it into health and wellness coach training programs. So the competencies are developed, but they still need to be validated, and we still need to share them with, you know, people who've been doing this for a long time.
But I think this is definitely a trend we're going to be seeing more and more of. And group dynamics are a little different. You know, this is something for people to study, for people to take some extra training in, take an advanced class in, that kind of thing.
Yeah, I really couldn't agree more with the group coaching, with making sure that you take some time to study it, because you know, I've facilitated group coaches in health or groups in health and wellness coaching, but also groups in personal training. And you know, there's so much energy that you can gather from a group, and it can really be life-changing for people. But boy, you better know how to facilitate a group before you do it. Otherwise it can be disastrous. And then it's a disaster in front of, like, you know, 8 people. So
exactly. And another big advantage of group coaching is group accountability. Oh, powerful stuff.
Yep.
So, you know, we've been talking here, we've kind of hit on this topic. You know, health and wellness coaching has been doing over the phone coaching since the beginning. All coaching, life coaching, business coaching has been really kind of centered on that. So I'd say the vast majority of coaching has been done over the phone or now via some kind of platform, you know, like Zoom. So we're really in great shape there. Another trend that you were bringing up is a bigger international presence.
Yeah. So just to give you an idea, this is just in my last 24 hours. I have had a meeting with somebody from Switzerland, a meeting with somebody from Israel. I know Nicole right now is having a meeting with someone from Colombia. And on Monday, we're talking to someone from Brazil. So that right there just shows you that this is the international barriers are coming down. And virtual coaching allows for so much flexibility. the challenge is the time zones, right?
Right.
So we see that a lot and kind of have to work around that. But I it's health and wellness coaching isn't just growing in the US. I mean, I really see it exploding across the world.
Mhm.
So, and what's really cool is that all of these countries are actually reaching out to us asking for guidance.
Mm.
So, we will be putting together a virtual forum that is all about, health and wellness coaching in the international space and
Right.
learning from everybody. And when we do that, which will be in 2021, we'll definitely let you know so you can let your audience know as well.
Oh, yeah, that'd be great. Yeah, we've really seen that too.
Mhm.
Tremendous interest all around the world.
Yep.
I've done 6 trainings now in China, and I've done trainings in Brazil and in Ireland and England. And, it's just, like you say, um, being recognized for the value of it. And I think part of it is, as wellness has grown internationally, one of the things that wellness coaching does is to me, it's always the way to individualize wellness. There's a certain amount of wellness programming done with classes and group norms and uh, easier access and better facilities. But a big part of it comes down to, at some point, somebody sitting down one-on-one and creating a wellness plan with someone.
Yeah.
And
Yep.
that's where the coaching skills are, all about that.
Hmm.
Yeah.
Yeah.
So
Yeah.
big, yeah, go ahead.
I
Go ahead.
think that it is really important if people are working internationally. One of the things that I've learned after talking with people around the world is just to be really cognizant and aware of their environment.
Yeah.
Because for us here in America, you know, we might take clean water for granted, right? Or something as simple as a good internet connection for
Uh-huh.
granted. I have, had conversations about water with people in other countries, and recently was talking with someone from Africa, and she apologized so many times because we kept getting cut off because her virtual connection was bad, but that was just part of her daily life.
Oh,
And
yeah.
so I think just if you're going to work in the international space, taking that time to really ask the client,
Mhm.
what challenges are you facing in your environment? Because it may be something we're not even thinking about.
Exactly. Yeah. We're going to talk about social and environmental determinants of health in just a couple of minutes. And it's all related to that, really.
Mhm.
Uh, I would say one of the things that's helped me tremendously to connect with people all around the world is I never take those things for granted. I never make assumptions. And as a coach, we're kind of inherently set up to be a little more culturally sensitive because we are always asking the client to inform us about their life
Mhm.
rather than us coming in and recommending that they, brush their teeth and, clean their nails and, do all this hygiene stuff and other, health information, which is all good. But it's more of a peer-to-peer rather than a top-down approach. And that works great, when you're talking around the world. Because, on the other hand, you're not just talking about the lack of development. You'd be surprised at the level of development in many places. You think maybe, India is this backward country. And in fact, there's like something like, what is it, 300, I forget how many million people have a college degree.
Mm.
The number of people that have a college degree in India is equal to the number of people in the entire US workforce.
Wow.
Yeah, so, there's that side too.
Mhm.
The other thing that we've seen a lot of, and we're doing a lot more partnership with, is colleges and universities actually offering health and wellness coach training as part of their educational curriculums. And I'm sure you've seen that too with more programs applying to be approved.
Absolutely. Yes. Without a doubt. I mean, in fact, I have a meeting after this with the community college in Los Angeles. So
Mhm.
yes, for sure.
Yep.
Also starting to see more colleges and universities employ health and wellness coaches who can work with their students.
Yes. Matter of fact, something that we've been working on with, University of South Florida and University of Central Florida and a couple others is developing peer health coaches among students through curriculum for undergraduates as well as graduates. And what they're doing is actually taking some of the stress off of the university counseling centers, who at this point really have to work more with really serious mental health issues.
Right.
The other thing that we're looking at that you brought up, and I think we're seeing a lot more of, and it kind of goes together with this one as well, is a lot more awareness of the need for more diversity and equity, both within our profession and in all the health and wellness areas as well.
Right. Yeah. Yeah. I mean, obviously, this is a really important topic, and I'm really proud to say that our organization now has a diversity, equity, and inclusion committee in place. And they just had their first meeting about a week ago. And I'll be working directly with them on a regular basis to really try to take the initiatives that they create forward. But it is a really important topic. I also think, with diversity and equity, you want to have access, right? So access to the health coach, but also access for people who want to become health and wellness coaches and may not be able to afford it. So I think, developing scholarship programs and doing extensive outreach can make a huge difference too.
Mm-hmm. Yeah, and it fits right in with more recognition of how, when our client is in a living environment that makes it difficult to be well, factoring that in.
Yep.
And never assuming that everybody has access, to all the wonderful food that maybe our neighborhood has,
Sure.
or our town.
Yep.
Or, and this can be urban or it can be rural. One of the things here in Colorado that we're seeing out on the Eastern Plains is small towns that have lost their grocery stores. And people are having to drive 50, 60 miles just to go to a grocery store. And then you, of course, have the urban situation with food deserts in the middle of the city. And it isn't just that. A lot of times it's, this assumption, oh, well, just go walking. Well, there's neighborhoods where you don't want to go walking.
Right.
So having coaches learn how to be a little more nimble at having conversations with people to figure out, okay, so how can I adapt to this, make the best of it, come up with a new strategy, and still be on my way to being more healthy.
Yeah, I agree. And I think it's a real opportunity for health and wellness coaches, right, to do work in a lot of the environments that you're talking about. Food deserts is another hot topic right now, right? And I think that the health and wellness coach can play a valuable role there. I haven't given a lot of thought to that, but I think that, with some creative thinking and partnerships potentially, right? Health and wellness coaches could probably really help people. They could really help people.
Yeah, one of the things that we did a couple years ago, we worked with a inner city minister and trained him and at least one of his staff or two of his staff to be health and wellness coaches. And they were working right in the middle of Columbus, Ohio, in neighborhoods that have tremendous challenges like this. And they had set up a food bank of their own. They had set up a gardening program, just some really great stuff.
Yeah.
And, people talk about, well, why don't you go to the local, farmer's market? Well, have you seen the prices at most farmer's markets? Oh, my goodness. Most of the folks we're talking about cannot afford any of that.
Right.
So it's coming up with creative solutions together.
Yeah. And just being cognizant of everyone's environment, which you touched on earlier.
Yeah. Never making assumptions.
Right.
Now, here's the big game changer. When we get beyond just level 3 CPT codes, when we get to the point where we are recognized as being, eligible for that level 1, wow, everything changes, doesn't it?
Does. Would you
And
like to speak
yeah,
about where we're at with that?
yeah, because I know a lot of people on the board have been knocking themselves out, putting in a lot of hours working on this.
Yeah, and I see in the chat box again, it's always probably the number one question that I get is where are we at with the CPT codes?
Yep. Yeah.
I want to explain that Category 3 CPT codes are generally not reimbursable. However, there are times when there is a Category 3 code in existence and an insurance company will opt to reimburse for that service. So the NBHWC is really working 2 lanes. So in lane 1, we have the Category 3 codes, which we're working to move to Category 1 codes. So what is required for that is an evidence base and data. And the data needs to show that health and wellness coaching is being practiced across all demographics in all parts of the country. So we are going to be partnering with a university, and that university will be charged with basically managing all the data. And then we'll be working with all of the National Board Certified Health and Wellness coaches across the country who have the ability to collect the data or to provide us with the data, right? So they have to work in a healthcare system, have access to an electronic health record management system, and then provide that data to our partner university. And then eventually that will be a report that we'll submit with our application for Category 1 codes. So we have a consultant that's helping us to do that. And this person has a lot of experience in healthcare economics and reimbursement. So they really understand it in a way that I don't, or even that our board members don't. So we are actively doing that, and we are actively seeking that. And we will get there. And then I do want to say, though, it does take time. Like even when we get the Category 1 code that is reimbursable, it then can take up to another year to get that value associated with it. So it's a process, and we're doing something that's never been done before for the industry, and we're basically pioneering this. So that's lane 1. And then in lane 2, you have the payers, right? So there's over 900 payers across the country. Payers are the insurance companies. So examples would be like United Healthcare, Aetna, Blue Cross, in San Diego, Sharp. It depends on your region.
Right.
But what we're doing is we're very deliberately going to be seeking reimbursement from payers. It will take time, but this consultant that we have has a lot of experience in that area. So it's going to take a lot of time and a lot of money. But that's basically where we're headed. And, we're really excited about it. It is a ton of work. And we recently just got a taxonomy code for health and wellness coaching, which is a big thing. And we'll be doing a release to our entire mailing list about this next week with a Q&A, so people understand what I'm talking about. And that's a quick summary of where we're at.
Wow. I'm glad you shared that with everybody, because you're really letting us know this is not magic.
No, it's so not. The hardest thing I've ever done besides a half marathon or a half Ironman. Yeah, it's very hard.
Oh yeah, and I'm very glad that you've made all these steps to bring in a consultant that's really familiar and so forth.
Yeah.
It's a strange world out there, and 900 payers is kind of mind-boggling. So the fact that you're so involved in this, I think, is one of the ways that the board really provides value to the profession.
Yeah.
And one of the reasons we need to support the board. I think that's really important. Let's see, Sherry is saying, and maybe I'm not sure if you covered this or not. Here it is. Does NWHC collect data on race, gender, and language for health and wellness coaches? If not, is that part of the diversity and equity committee? And maybe something, that they might be working on.
Yeah, that's a really good question. Nicole could probably answer that a little bit better than I could in terms of like when people register for the exam, what is the information that's collected? I know that's been updated, and I really just am not as involved in the exam portion of things right now, so I don't have a answer for that. If she is referring to the data that will be collected regarding the usage of the category 3 CPT codes, we're still settling on what data points will actually be there. So that'll all be determined probably within the next 2 to 3 weeks, as we're signing that agreement with the large university that's going to oversee the data collection project. But I do agree actually. And with what this person is asking, I think it's actually incredibly important. And so I will bring that back to the Diversity, Equity, and Inclusion Committee, because I think she brings up a valuable point. And I know some of the data is collected on the front end, but probably a lot more needs to be collected.
And that may be one of those things where legally you have to ask the person to opt in or not to revealing that, that kind of thing. Yeah. So I just want to hit on a couple more things, and then I really want to open it up wide open for Q&A. One of the things that we also want to take a look at is some of the bigger trends in the whole wellness field that affect health and wellness coaching a lot. And I took a look at the Global Wellness Summit. They put together a panel of experts and media people, and they took a look at what they thought were some of the things coming in the whole field. And one of them was a real convergence between healthcare and wellness. And of course, we're right in the middle of that.
We are.
Yeah.
Yeah.
Which is really kind of cool because, and it is a big trend that we've seen more and more coaches actually working directly in primary care settings. Mm-hmm. That has been a trend that I think we're going to continue to see. I think it's also a trend that we have to be kind of careful about because, we can kind of over medicalize health and wellness coaching. And we've got to realize that, yes, there's a need for some people to be coaches that also wear a second hat where they are a medical professional, but there's also a continued need just to look at changing behavior related to health, and that can be done by people without any kind of medical background.
I completely agree with you. And I think that having the training and education standards backing the coach, right? Mm-hmm. So someone who's calling themselves a health and wellness coach and who's actually attended an approved program and perhaps taken it to the next step and has the National Board Certification credential, they are well qualified to step into that role, right? Into the role of partnering with the physician for better patient outcomes. But also, I don't want to forget the other piece of coaching or the other group, which would be entrepreneurs who want to coach the public, but perhaps don't want to partner with a physician. Maybe they, want to work with teenage girls or, adolescents or the senior population, and they may not even be tied to medicine. And although it all ties together to better health, so I think it's a fine line, right, between spending a lot of our time on seeking reimbursement and integrating the health and wellness coach onto the healthcare team, but also paying attention to, supporting people who are entrepreneurial or who work in employee wellness, in school systems, lots of coaches in school systems. I mean, I would love to see every school have a health and wellness coach on their staff.
That'd be awesome. Yeah. I think another aspect of this convergence is the healthcare field recognizing the importance of behavioral change in medicine, the whole lifestyle medicine approach. The other thing that the group was saying was a big emphasis on ways to strengthen the immune system. And the panel went on to talk about all kind of high-tech um, things that are probably not going to be accessible to 99% of the public, quite frankly, in the report. But what we really know is that what affects the immune system more powerfully than anything is stress. And coaches are fantastic at being resources to help people with stress management.
Mhm.
So I think that's a real plus that we can capitalize on. Another thing that they saw as a real trend was increased contact with nature. And health and wellness coaches, I think, can help people to, strategize how can I manage to get out into the natural world on a more regular basis? How can I do that? I know, Leigh-Ann, you are a big fan of getting your whole family out into the wilds.
I am very much. I have a rule for myself that I have to spend 1 hour a day in nature.
Ah,
So I do too. I
oh,
do. Yeah. I either hike or run or bike or swim outside every day for an hour. So
well, and there's new evidence that says that when we exercise outside outdoors, we actually get more benefit from it.
yeah, I mean, I can't imagine not doing it because it's just such a part of who I am. And both Michael and I talk a lot about national parks and backpacking and
Mhm.
camping, and so yeah, it's just such a part of who I am. But I definitely do see this as a trend. There are, and not just a trend, but a necessity, right? And there are, so many books that are coming out about the benefits of nature, and
Right.
yeah, it's just, I think it's really neat that this is something that is a hot topic right now.
Well, and we've also seen it because with the lockdown, this is the kind of recreation that people can do safely. And there's been a tremendous uptick in it, tremendous. The other trend they saw was, and again, this is where coaches can really help people with strategizing and organizing, is kind of creating our own wellness refuges
Mhm.
within our homes. That quiet space where we can sit and relax or meditate. Um, I just rearranged our guest bedroom so that I have a lot more floor space to work out, things like that, all sorts of stuff.
Yeah, and I think it's really important because now that so many people are working at home in a
Yeah,
home office, you
right.
have to be able to have that separation
Yes,
between your work life and your home life and your wellness.
exactly. Very well put. So, some challenges moving forward. Um, Here's just a few that I think are pretty important. And Leigh-Ann, you and I can talk about this. This is something that we have talked about here already. Um, it's going to be a challenge, maintaining this high standard. I think there's going to be more and more people that are going to jump into health and wellness coaching, and they may or may not make the investment in their time and energy and money to get the training that they need. And also, I think that's going to help us maintain the high esteem that the public and related professions view us through.
Yeah, I mean, I feel like we have a big job at the National Board for Health and Wellness Coaching because we have to do a lot more outreach, right? To really explain that training and education standards matter, so that if somebody is
Mhm.
hiring a health and wellness coach, they're hiring somebody from an approved program such as Real Balance, or someone who has the National Board certification. It's
Right.
really going to take a lot of time and a lot of money to do this extensive outreach, but it's really important.
It really is. And also, I think we've got to look at how do we make coaching services more affordable?
Mhm.
And it might be through a lot of different ways that people access the systems, and of course, eventually reimbursement. But something that I've talked about a bit is a kind of a tiered approach, where some people get individual coaching, but other people group coaching, and maybe other people, if they are actually pretty self-motivated and self-directed, there may be ways that technology can just reach out to them adequately. It's not going to do the job for everybody, but we may be able to cover some folks that way too.
Yeah, I mean, it would be great too, this is something I've thought a lot about, independent from the national board, but just, like more nonprofits that actually value coaching and can connect people who don't have the ability to afford a coach to a health and wellness coach.
Right, exactly. And also, maintaining our identity and function as wellness coaches focused on lifestyle improvement. I think there's going to be a lot of pressure to kind of pull us in a lot of different directions, to have us do stuff that may be outside the scope of practice, or I think folks that aren't familiar with the field may expect us to. I think we've got to really say, okay, this is who we are, this is what we do.
Totally agree with you. It's just staying within that scope of practice and being really aware of it as a health and wellness coach makes a huge difference.
Anything else you might add to the challenges? Or we can get on to our
No,
Q&A.
not really. Yeah, I feel like we should. I know there's a lot of questions and I want to answer them.
A lot of good stuff. We got a lot of attendees and more that are going to watch it later. Let's take a look here at some of the more recent things that have come up on the Q&A. Let's see. And okay, maybe you can address this one from Leslie. How can we as board certified coaches help the board to get the word out about the board? Is there a standard quick reference piece that we can share in soft or hard copy?
So in terms of messaging, I think that social media is actually a great tool. So we're very active in LinkedIn, Facebook, and Instagram. And we also do have a Twitter account. But I think that we need to start doing what in marketing we call blitzes, right? So regular blitzes where we all share the board certification logo and try to get the word out to the public. I think that would be a good way to do it. In terms of a standard reference piece that you can share, that is definitely something that we need to develop. And it will be probably developed within 60 days. It's top of mind. We recognize that this needs to happen. We just have had a lot on our plate in the last year. Sure. So, but if you're looking for talking points, just send me an email and I'm happy to share some really good talking points with you. We have a bunch of different documents that we pull from, but we've got to put it all together in something bright and shiny and shareable. Yeah,
real easy.
Yeah.
Yeah, and how many people do we have now that are board certified coaches?
4,100. I think it's 4,162. And then, wow. Yeah, we have about another 1,000 sitting for the exam in February, and then obviously there's another exam in October. So we'll be definitely above 5,000 by the end of 2021.
Fantastic.
Yeah.
Okay, so there's some great resources for you. Another person is asking, is there any work being done to limit the use of the term health and wellness coach by others who don't meet the national board standards to further legitimize our profession?
Yeah, that's a really great question. No, there is not. This is not a licensed profession. It probably is not going to become a licensed profession. There's a lot of positives, but negatives in licensing a profession, and we don't feel that we want to go in that direction. So there is not a direct marketing effort to stop people from calling themselves health and wellness coaches. I think instead we have to focus on the positive of highlighting those who are well-trained health and wellness coaches and who meet the standard, the training and education standard.
That's a really important distinction to make. I know, years ago, we've been involved in some different efforts that were made by different legislators to make coaches in general subject to licensure. And we really resisted that and said, no, you know what? we are not treatment professionals. We are not, actually, performing treatment on people. So it doesn't fall into that category.
Right.
And the other thing is, there's liability and insurance rates that are very different for a profession that is open to those kinds of things.
I do want to add that
Yeah.
one of the cool things that's happening, well, two really cool things. One, we're very connected to this great guy. His name is Daryl Rogers. He's based out of Washington, D.C., and he does a lot of policy and lobbying work on behalf of health and wellness coaching, not on behalf of the national board, because we can't lobby, but that he does a lot of creating awareness about the profession and working with Congress and other politicians to really drive this home. So we have that connection. We're not directly involved, but we have that connection, and him and I meet usually monthly just to talk about what's going on. The other thing that's really cool is that right now we have a legal team who's working on the language around health savings accounts, right?
Mm.
So that we can have real clarity and provide a real distinct message to coaches as to whether or not their clients can use their health savings accounts to pay for health and wellness coaching. So it's a little bit of a gray area. I know there are some coaches who are doing it, but it's still gray area, and the IRS still doesn't actually recognize the health and wellness coach. However, we're working to change that, and we're going to get there this year, no problem. But that's something we're actively working on.
Oh, fantastic.
Mm-hmm.
Great. Here's a rather tough question. I'm not sure how you can answer it. Sasha is asking, could you speak to the ROI of health coaching in employer wellness programs? Is there data available that singles out health coaching specifically in wellness programs employers offer?
So I don't know the answer to that question. I don't have the data in front of me. I think that the National Wellness Institute could be an organization that may be able to speak to the employer wellness programs a little bit better than I can.
Or WellCoa.
Yeah, that's actually a really good resource. Yes.
Yeah.
Yes.
Yeah, that may be a better resource for the employer wellness programs even. You may be able to dig out from that compendium some studies that fall into that category also.
I didn't mean to. I was going to put that to everybody. I meant to type in WellCoa in case people didn't get that.
Oh, okay.
All panelists, and I'll retype it.
Okay. Yeah.
They should look
at
that.
WellCoa is Wellness Councils of America. Yeah. Yeah. And so we're wrapping up with time here. So what I want to do is really, first of all, thank you tremendously for, just being here with us and just providing, so much knowledge and wisdom about all this. What I want to do is invite people to check us out at realbalance.com and take a look at the training that we're offering. We've got lots and lots of classes being offered that are all live interactive webinar classes, and very accessible to everybody at different times of day and so forth. We're going to be getting together again in February, and we're going to announce our topic for that in the days to come. So in the meantime, to stay informed, sign up for our newsletter at realbalance.com. That's the way to stay up on top of all that. Subscribe to that. Also follow my blog. I actually put together a blog on this topic of trends. That's the current blog. You can find that at realbalancewellness.wordpress.com or just at realbalance.com. There's a place there where you can locate the blog message as well. So I just, I'm real happy with our great turnout today, and I hope people will share this. It's going to be posted on our website for you to be able to share with people probably within a day or two. And once again, Leigh-Ann, thank you very, very much for your work that you're doing all the time with this. It's they're very fortunate to have you as director, I've got to say. And great to just know you as a friend and colleague.
Yeah, I know. Thank you. I'm so excited that you had me and it was fun. And you have to, as soon as this is over, you have to come out to California and we'll go to Yosemite.
Oh, that's on my bucket list.
I know we have to keep the bucket list going, right? We have to keep
We
looking
do.
ahead. Yeah.
Absolutely. Okay. All the best to you, and be well and stay well, everybody.
Bye-bye.